How to suture. So to start, you need to first grab a few items. Non-filament, which is the stitching. It's basically what they use in the hospital. You can buy it off Amazon. You can find it in some first aid kits. It's just generally useful for any stitching. Although you can use things like string or fishing line. You just have to make sure they are sanitized before you use them on a patient. Then we have our needle drivers. They lock, so when you're gripping the needle, you don't have to worry about it moving or falling out and losing it inside of a patient. They're really useful for just movement in general and in stitching. And then we have our forceps, which are pronged at the end, and they're mainly used for gripping the skin so it stays in place while you're using the needle driver. And then you have your scissors, which are just used for cutting off the ends of the stitching. When you remove your filament from the packaging, it's just this light blue string with this curved needle at the end. It's very small but very sharp, so you be careful not to nick yourself or a patient in a spot it's not supposed to be inserted. When gripping the needle with your needle driver, you can use two different grips. I personally like to palm my needle driver, but you can also use your ring finger and your thumb. Now, when you're grabbing your needle, grab it at a 90-degree angle from the top of your needle driver and then lock it into place. Now the needle won't move, it's secure, and you don't have to worry. But when the needle is attached to the needle driver, the one thing you do have to worry about now is pricking people. When the needle is free hanging, it's not really a threat. It's not going to hurt anyone. It's going to be fine. But now it has the ability to hurt you. You can poke yourself or you can poke someone else. Now when starting, start a couple millimeters to the right or the left, depending on what side you want to start from, and then a couple centimeters up from the bottom. Now, you want to push up and through using your forceps to hold the skin in place. And then now that we see the needle sticking out, we're going to grab it with our forceps, unlock the needle driver, and pull it through. We're going to pull the filament all the way through until there's only a few centimeters left of fiber at the end. We're going to want the filament to be pointing up, as it's going to make the next step easier. Now that it's there, you're going to want to take the fiber in your hand and hold it by the needle. And then while holding it out, you're going to, from the edge of it, you're going to measure 2 palm lengths. And then that's where you're going to hold it with your non-dominant hand. And then now, you're going to take your needle drivers, and then you're going to wrap the fiber around them twice. Then grip that few centimeters you left hanging with the needle driver and tug on both sides. To secure the knot, make your non-dominant hand go to the left and your dominant one go to the right, and give it a couple tugs, and that'll set your knot. Now, you're going to repeat the process, but only wrap it once, grabbing the fiber and pulling through, alternating the side that you pull. So the part that's sticking out is going to go to the left and then to the right, and then repeat the process about 4 to 5 times. This is called a square knot. Now that that's done, you can do this after or right now. You take your scissors and you remove the excess fiber. Not quite down to the knot, leaving a couple millimeters of fiber, but pretty close. Now, in what's called a figure 8 stitch pattern, you re-put the needle in your needle driver, grab your forceps, and you go from the same side that you punctured before, going down, up, and through. Grabbing the needle when you see it, unhooking the needle driver, and you can even use your needle driver to apply pressure to help pull through. And then you pull it all the way tight. And then with the needle in your forceps, it helps you grab it at a better angle. Grab it at a 90-degree angle again. Lock the forceps and go in from the same side you just entered. Down, up, and through. Pulling it all the way through again. Closing that part of the wound now. And then like before, you grab it, hold it at a 90-degree angle, pushing down, through, and back up. Grabbing the needle, and once again, pulling all the way through. Now for our last one, much like the first. And then we're gonna almost pull all the way through, but not quite. Much like the beginning where we left some thread at the end, there's gonna be a loop. And we leave it about that big. So not too big, not too small. And like the beginning, you're gonna put your driver on top, wrap it around twice, gripping the top and center of it to make it easiest to pull through, and then make a knot. Securing it, and then repeating the process. With our scissors, we cut off majority of that loop, just like the little bit at the beginning. And that is how to suture.